Wednesday, sponsored by Baptist Health.
Well, May is Stroke Awareness Month, and no matter your adult age, you need to pay attention. People think strokes only happen to their grandparents, but they are increasingly hitting people in their 30s and 40s. Joining us to help us understand all this is Dr. Jessica Udeogu with Baptist Health Family Clinic in Rose City. Dr. Udeogu, thank you so much for your time. So we still think of strokes as something that happens to people in their 80s, but this is happening to people who are younger and younger. And we want to know, why is this becoming a trend?
Well, we're getting sicker and having chronic illnesses younger and younger, like uncontrolled blood pressure problems or hypertension, diabetes, and problems like that. Smoking, alcohol use, which can cause problems to your vessels, which is essentially what a stroke is.
So we always hear about drooping face or slurred speech, but what are the whisper symptoms that we need to be paying attention to?
If you have sudden onset like dizziness or unexplained falls, that's concerning. If you have like headaches that you can't really explain, confusion, or you can't really find your words well, those are symptoms that can kind of be telling us something's going on.
Is there anything a 35-year-old is ignoring today that could cause a stroke tomorrow?
Yes, most definitely. Uncontrolled high blood pressure. Hypertension is something that you can't feel it. It's called the silent killer for a reason. People are like, oh, I feel fine, there's nothing wrong. Meanwhile, maybe in their 20s and 30s, they've had an uncontrolled blood pressure that they haven't addressed, along with diabetes, smoking, and all those other things.
So we hear about mini strokes and that people often ignore them because the symptoms, as you just mentioned, can go away. Can ignoring these mini strokes potentially lead to a larger stroke?
Most definitely. A mini stroke is called a TIA, or a transient ischemic attack. So those are signs of like blockages in the brain that kind of go and come. So definitely don't want to ignore that. That could just be telling you need to get in with your doctor, make sure your chronic diseases are taken care of.
What about your family history? If you have strokes that run in your family, could it be something passed down?
It can be. Your family history is important because you need to know if you have diabetes, blood pressure problems, high cholesterol, because the cholesterol part can be genetics. So knowing that can be very helpful to you, so you can address those things earlier and reduce your risk of stroke.
So if someone heeds the warning signs and gets help immediately, there is a chance that they could make it, right?
Oh, yes. So now technology has been excelling in that area, along with medications. There's interventions that can reverse symptoms pretty quickly, but you have to get help really fast.
All right, Dr. Udeogu, thank you so much for your time.
Yeah, of course.
If you would like to get in touch with Baptist, just go to their website or give them a call. That information is right there on the screen.